My brother would
Please.
he was not able to walk even for 1 minute because his legs would go completely numb due to no flow of blood in his legs, and he would feel as if there's something sticking feet underneath, and he would immediately look out for some support to sit down. Otherwise, he would just drop, fall down. And that was the condition when we went to doctor at Hyderabad last month. And right from the day one, my brother's really feeling, he started recovering very well. And Sastri,
Rita has been with me and she has been trained by me. She has been doing good. She has seen all type of patients over the center. Rita, can you tell them your experience about what you have seen, what you have found?
oh yes, of course, yes. I was like, totally shocked to see. So get more worked up than the patient who comes in because he could not see the pain of the person walking in. And I think most of the patients come after trying every other thing possible or wherever, except to reach out. So when they come here to Shastri sir, their condition is really, really very chronic and critical, completely bedridden. And sir, make sure that in the very first sitting, at least they are relieved of their pain to a very, very great extent. And until and unless their pain is not relieved, sir doesn't stop working on them for the first sitting at least. And then once they're relieved of that pain, then the next sitting is much more comfortable. Even the patient also has a lot more faith, and they continue staying there for their recovery. This is what I observed, and he's got a great team which supports him also. Everyone is like, on their toes all the time from 8 in the morning, I think so. The room visits and all that starts off, and that goes non-stop. Even if somebody walks in at 10 or midnight, or someone is really unwell in the middle of the night, everyone is ready to serve them. This is what I have observed and experienced, sir.
So I declare that forth up that these are interactive classes. Everyone is allowed to enter. Whether he writes his country name, anything, let him enter the classroom. Please don't remove anyone. Right? Please don't remove anyone. This is not the diploma class. No. Now people will be asking whether acupuncture can recover or not. You have seen my large career of many, many years that we have recovered large number of patients, even small kids who are quadriplegic to many, many, many difficult diseases where surgeries, post-surgeries have come up and they could not recover. A small CP child start developing, walking on the treadmill. All these videos you can see where in the Facebook. Can anyone give my Facebook link in there? Now I encourage you to ask questions. First of all, you ask your questions. There are a lot of questions in your mind. Legal question, illegal questions, whatever you have. You ask your questions. Interaction means what? Not the class. Means knowing each other. I don't know who you are. What is your
Yeah.
background? So
Hi,
by the
doctor.
question you ask, I can understand in what way we can go ahead, right? So you may ask me a
Yeah.
question.
Can I?
Yeah,
Yeah.
introduce
Thank you,
yourself.
doctor. I am honored to be in this international platform. Thank you so much for inviting us for this wonderful session to interact with you. So I want to ask you when we are going to start that diploma class, sir.
I will start shortly. At least let's see. The problem is that too many hookup has come in the diploma training classes. Too many words have come up. So the doubt should be clear.
Yes. Okay. To introduce
What
myself,
are
I am
the doubts?
Diploma.
See, people do not know what is acupuncture, right? Lot of people comes to me from the best hospitals of Hyderabad, like Rainbow Hospital. Today also one patient has come who is already on ventilation,
Yes.
right? People bring their patients from ambulance from Bangalore.
Yeah.
Now,
Even,
where is my advertisement?
sorry, doctor.
Where is my advertisement that I can recover this type of patient?
Yes. You are a genius, doctor. So people will know
So
around the globe.
there is no one genius in this world. One thing I
Sorry.
tell you, after you clear your doubt, you become a genius.
Thank you, doctor. Thank you so much. Yeah. Sure.
See, the problem with us is our own doubts, our own apprehensions, our own conclusions which we derive. It is self-anxiousness which destroys our knowledge.
Yeah. Yeah.
Who destroys you? You yourself.
Yeah. Sure. So I really admire that I completed the diploma for 5 years in acupuncture, acupressure, and I'm doing in a research-oriented way actually. So I saw your post in Facebook by chance. I'm on that path actually. A research-oriented learning in acupuncture with all clear-cut picture. That is why I come to this diploma program. I'm from Kerala, southern part of India. To introduce
I
myself,
have
my
gone
name
to
is
Kerala, Kollam.
Kollam. You came to
Yeah,
Kollam?
yeah. I came to Kollam. We had a camp in Kollam, and
Yeah,
we have got many patients. 3 days.
yeah, yeah. I am near to that place actually. My place is next 40 kilometers away from Kollam.
Yeah,
Thank you.
we have recruited many patients from Kollam. I have many students from Kerala.
Yeah. Thank you so much, doctor. Thank you. Yeah.
Okay. Ask your questions, please. First, clarify your doubts. My first thing is, what is in your mind, you speak out.
So this diploma course, you are focusing on, is it only the pain management, exactly on the pain management?
We have written, see, when we were completing our fellowship class, our students have requested for many topics to be completed, right? Like Alzheimer's, how many classification of Alzheimer's are there? What is the pathology of Alzheimer's? How much we can help? To what level of recovery we can bring? What you can do in your clinic? I have seen many of our students who have been trained from here. When I see their results, what they have done in the clinic, it's wonderful. One of the students, Dr. Angit Agwana, is a physiotherapist. He was able to remove tracheostomy in just 22 days.
Okay. Okay. So it's all kind of clinical practice you will advise through this diploma, right?
We have given our browser, we have written the name of the disease, pathologies of the disease, what as a physician you can do, what are the things you can do, what acupuncture can do, what is the allopathic line of treatment, how to understand.
Okay.
how to understand the disease, how to understand the problems. See, without having a proper knowledge, if you treat a patient, you will be in trouble, right?
Sure, sure. Yes. Yes.
So today, if you see spleen deficiency, kidney deficiency, it's your part, not the public part, right? You must have a
Yes.
good knowledge on the subject so that
Yes.
good anatomical knowledge. Today, even if you see a neurosurgeon has a good knowledge of the brain, then only he can recover a patient. He can do a surgery. There are two things. A patient is having a sleep disk, but every sleep disk is not operable. Rita Shah's brother is more than 130. How many kgs, Rita? Rita, what is the weight of your brother?
110 kgs.
110 kgs. If you operate 5 sleep discs in 110 kgs, what will happen to the patient? Can anyone tell me, if I remove 5 discs from a patient who is of 110 kgs, what will happen?
Obesity is an obese condition, so it will be like.
So what
Patient
will
will be
happen to the
unable to
patient?
walk, sir, and sit also.
Huh?
Patient will be unable to walk and sit also
You are correct.
because lamina could not support him and muscles will be fibrosed and tired. Then pain will also present there and patient unable to sit and walk.
Most important thing, the patient will suffer from neuropathy,
Yes, sir.
right?
Yes, sir.
So you can see 75% of the cases, even that orthopedic doctor who came to me, he said that we can recover these cases without surgery. He has operated more than 3,000 surgeries and now he has given up surgeries and he has choose this medium because people want to avoid surgery. Who will come to you who wants to avoid surgery? But in that case, you must be able to read what is the condition of the MRI, what is the anatomical condition of the patient, what is the physiological condition of the patient. For example, if you see when the patient is discharged from the hospital and he comes to you after 3 months, you see the discharge summary and the discharge status, right? But by now, the patient is quite recovered. You understood? Patient is significantly recovered. So, recovery is a very good status which you can obtain by integrating it with your own science. I don't say acupuncture is a very superior science, but if you go to YouTube and see, acupuncture anesthesia was practiced by me also, which I have left. And today also, when severe pain patient comes, I use it. And within 10 minutes, patient's pain is revived. This is a allopathic hospital, neuro rehabilitation hospital with Indian Institute of Neuroscience for training new people, right? But you will see, we hardly use painkillers over here. Minimization of painkillers, very important part of the treatment. And sustaining the patient, recovering the CP child, delayed milestone, autism. You know, a patient has come all the way from England for what? The recovery of autism. I'm amazed to see the focus seizures, which used to come after every half an hour, has been finished in infantile spasm. If you see my videos from last 6 years, I've uploaded large number of videos where you will see large number of patients have recovered. My lectures are also there. You can hear my lectures and all, and you will understand it's a easy science. Only the problem with us is what you know. We don't focus ourselves. We don't see the disease and the pathology of the disease. बीमारी क्या है, बीमारी को कैसे किया जाता है, what is a disease and how it has to be managed, we don't see. We just put our knowledge what we have and then we finish it. For example, a person of 105 kg goes to a chiropractor. What will he do? He will do chiropractic technique, and what will happen? The disc will be more extruded. So MRI studies, knowing what you have to do, where to do, what to do, is the purpose of this. We will be giving you no doubt so many protocols by which you prick the needle or you use a stimulator or you use certain thing. Patient pain will go away. But until patient gets a sustaining relief, it is not a recovery. Pain relief is not a recovery. Pain is a symptom. Pain is not a disease. After diagnosing the disease, it becomes a disease. Initially, it is a symptom. Initially, pain is a symptom, not a disease. So, to know the disease, we must know the diagnosis. And then the grading of the disease, which grade it is. Grade 1, grade 2, grade 3, grade 4. Now in grade 4 allopathic doctors, all the best physicians I have seen, we come across all the prescriptions, right? Such a big files, such investigations. To read them also we have to spend the whole night. After reading this, we conclude that there is no conclusive treatment for this patient. For example, now I got a patient who had an injury over here and he was done craniotomy and the patient became quadriplegic. The doctor in the Rainbow Hospital, which is the best hospital of Hyderabad, he said after removing him from ventilation, you can take him anywhere where he can be treated. We cannot treat quadriplegia, paraplegia. And I'm treating them easily with the dry needles. Many of my students are doing it. Problem is what? Problem is you're on way of understanding the disease. There was a lot of misunderstanding, like who is a quack, who is this, who is this. Now the question about the quack is, if you don't have a knowledge of driving a car, and if you drive a car, what will happen? What does the law say? Huh? What does the law say?
You should have a license and know to drive a car perfectly.
If you don't drive a car, if you don't know how to drive a car, what will you do?
Accident.
It can lead to accident.
And it will take away someone's life forever. It will do what? It may do a road traffic accident. Your meningeal artery which goes from here is injured and your life is spoiled. Every day large number of accidents are done. Why? Because people do not drive carefully. Today when I go to Hyderabad road, I see every time there is an accident. And that accident leads to what? Lifelong paralysis. So do you want to have all those experiences? Why don't you take an effort to recover that patient? Why don't you start learning? I have seen an accountant who was working in railway. He came and said, "Sir, I will learn." Initially said, "It is difficult for you to learn. You are a man of accounts." But later on, I came to know he is doing very good. His way of explaining a disease is much better than what I explained. So don't have inferiority complex inside you. Don't have superiority complex. That Gagarin can be recovered by you. Those diseases which you cannot recover, please don't recover. But what you can recover, recover. Paralysis is very easy to recover up to a certain extent. So to that extent you recover it. Even the hospital does the same. Now in ICU, what do? We recover the patient to a certain extent. After that, what we do? We say, take home or refer to a higher center. Everyone does the same thing. You are not adapting to a new practice. But the only thing is that laws are made only to help you to not to get in trouble. In Philippines, they have laws. In India, we have appropriately trained person. So why don't you train yourself appropriately? That's all. Tomorrow you come and claim that I can recover kidney, CKD, chronic kidney disease. What will happen? Under Medical and Remedies Act, you are under jail. If you say I can cure cancer, I can cure slip disc, you are in trouble. You cannot use the word cure. Right? Those things we have to understand first. Now, for example, tongue acupuncture. Many people know tongue acupuncture, right? You prick a needle distally and the pain is gone. But did you treat from here locally? Did you treat properly? Where are the roots? Did you treat him from the causes of the disease? No. Then what will happen? The compression continues and it leads to neuropathy. When it becomes neuropathy, the first symptom of neuropathy is burning sensation. It's called paresthesia. And after the nerve damage, what will happen? His muscles will become weak and he will become paralyzed. So is tongue acupuncture treatment for the cervical spondylitis? For pain management, it is correct. But for the treatment of spondylitis, there is a procedure for which we must adapt and recover the patient. Everything has a procedure. Our problem is we do not know the procedure. So what we do? We make heavy mistakes. That is why I said, first learn the allopathic point of view, what is diagnosis, then learn what you can do in that. What is your role and how your role can be applied in recovery of the patient. What are the necessary points which you can use? What are the necessary things you can use? right? Don't do whatever you like. Do what is necessary at that moment, which your mind applies. You understand? Diseases are, lot of diseases are that. One disease is associated with lot of comorbidities, right? I saw one doctor giving a steroid injection to a high diabetic patient. What will happen? He is also under trouble. One doctor operated a patient without testing his glucose. He was in an emergency. Patient had tachycardia and he died. He had some cardiac arrest, not tachycardia, cardiac arrest in the OT room, and he died. So whatever medical rules applies to anyone is applicable to you all also, right? Again, my humble request, please don't remove anyone from the classroom. It is not the diploma course, it is an interaction. Interaction means having conversation with each other. Yeah? First, you have to clarify your doubts, and I have sufficient time to clarify your doubts. You may ask me your questions. If you cannot recover a patient by the needle, other methods are also there by which you can recover. Needling is not necessary in all the cases. Just need to create one good impulse. What does needle do? It creates an impulse. That impulse will recover a patient. So you are encouraged to ask your questions. Whatever doubts you have, please ask openly.
So can I pose one more questions?
Please post your question, please.
Yes, after the COVID time, across the globe, people are in psychosomatic, emotional trauma and all. So how can we help for this kind of depression and emotional trauma due to COVID and all? It is increased.
See, all this is called emotional. See, whenever you have emotional trauma, there is a disbalance of neurotransmitters in the brain, right? These are called what? Acetylcholine, dopamine, and all. So when it is this, it is called adrenaline crisis. What it is called? Adrenaline crisis. So
Sorry.
by using certain acupuncture points like PC6, Heart 7, LI11, Liver 2, right?
Yes, good and deep. Yes.
Yeah. You send signal to the brain will calm down. Calm the brain. Whenever anything is aggressive, calm it down. When the nerves are irritated, what to do? Revive the nerves. When the brain is not developing, you give suitable impulse inside the brain and neuroplasticity is created. Brain can be developed, but then we did not study how to develop it. Research papers already has written about the G lymphatic system, Parkinsonism, everything has been written. But do we take an effort to revive this type of patients? No. Always I see increase of syndopa dose. But patient is thinking, nah. At that level, you can help them. Let him continue conservative medicine. No one is telling you to stop the medicine. But side by side, if you give this treatment, Patient will revive them. So your role has to be selected by you. What kind of treatment you want to do, what kind of treatment you have understood, and the grading of the disease. That is why I say acupuncture integrated with medical science. I'm not going to teach you TCM, liver is wrong, this. Yes, definitely we will integrate that part also. What was taught in Nanjing University, what is taught in Shanghai University, all 2 years course material is with me. Definitely we will use those course material also to understand. But today's people, will they understand what is, uh, if a person is coming with X-ray or complain with cervical spine and an X-ray, will you tell him it is kidney deficiency? Or you will tell him it is prolapse? It is PIVD, prolapse of the antevertebral disc. After all, you have to convince and you have to go ahead. You must be able to read both the X-ray and the MRI. Comparative studies. So tomorrow you don't need to depend on MRI alone. You can depend on X-rays also. For example, today patient always comes to me with a severe complaint of this one. On his MRI, I found there is no pathology in the spine. I was amazed why it is like that. I spoke to him for 10 minutes and then I realized it is because of stress. This acute spasm arises because of this and he has severe pain. And today when I gave him the stress treatment, which generally we give, what happened, immediately felt better. Fibromyalgia, all these diseases can be revived. Our only problem is we have not focused. We have focused on many things, but we are not focused on the disease and how to revive. We have focused on painkillers. We have focused on what? We forgot that the brain is the factory of all the medicines which we need to recover our disease. Extra medicines are also required, but on the other hand, this medicines helps the body to recover. For example, chicken pox. Who recovers the chicken pox? The body itself. Can medicine recover chicken pox? In 6 days, chicken pox is recovered by itself. When I had chicken pox, I used acupuncture needles, and what I saw, the allergic mediums and everything went down. I did not have, and within 5 days, I came out from my quarantine period. And yes, that was a very beautiful time for me to recover. If you know that, at least you can help yourself. You can help so many people. In 4 or 5 days, I recovered and I came out. And I came out. After 2 days of recovery, I went to Kerala and I treated the patients. Whereas my full body was full of chicken pox. Now you can see in my face also, you will not see any type of spots of chicken pox. So don't think that acupuncture is only pain management. Acupuncture works on internal medicine also. It works with irritable bowel syndrome also. It works with large number of diseases. Only it is our problem that we do not know how to use, what to use, and in what manner to use to revive the disease. We make the treatment also complicated and the disease also complicated. That is why grading of the disease is very important and knowing your limitation is important. You cannot treat gangrene. Gangrene is what? It's a type of disease which is a poisonous. The poison will spread in the whole body and the patient may die. So why are you afraid of that? You are not supposed to treat it. Even a medicine doctor is not supposed to treat it. It is a surgical subject. If a medicine doctor treats it, we will also face the same music. Practicing with fear is also not correct. You must have confidence to practice. I am practicing with lot of critical cases. I am not fearful. And why you should be fearful? And at any age, every aspect, you should try to improve your practice. You may ask me your questions. You may please ask your questions, please. This is a question answer session. So please ask your questions.
Hi, sir. Good evening.
Yes, sir. May I know who's speaking?
Sir, I'm Sunil Jain speaking from Delhi, your old student.
Oh, Jain Saab, how are you?
I'm fine, sir. How about you, sir?
Don't you see? I told you one day I leave my home for my practice. And I
Yeah, definitely, sir. But I've seen, I've heard many of the things about your sickness and various things during the past few months or years. You were, you
left
felt.
my home, my family, everything. My mother and father have died. And
Yes,
now
sir. I'm in.
I'm
I,
to my practice and nothing more than that.
Sir, I have the information because I am still in the groups. On and off, I kept, getting informations about you.
So I got
Thank
enough
you so
time
much.
to practice, and now I got enough time for research and making it more easy,
Uh,
making Mycosia more easy. Reading
right, sir.
a big book, I made it a very thin book.
So we are looking forward for getting knowledge from your point of view. So that's the reason I just wanted to do this course. In fact, my question is, what we are going to read during this particular diploma course for 3 months and so, and what are the prerequisites for attending the classes and all that.
There is no prerequisite. See, the only thing is that prerequisite is your desire to learn and know your
Okay.
limitation.
Thank you, doctor. Yeah.
And what is the core subject or type of syllabus?
I have given the transcript of all the subjects, like including movement disorders, Parkinson's,
Okay.
Alzheimer's, delayed milestones. I've included all the subjects.
Okay.
You please see the brochure. Are you in the
Sir, I
group?
have seen. Yeah, I have seen, sir. I just
Yes,
wanted
we
to ask you,
included
precisely in depth about type of system of
I'm
education.
going
what
to
they are-
include all that. See, how do you see PIVD, cervical pain? How many types of cervical pain are there? Then how will
So
you
since
know
you
if it is a cervical pain or medullary tumor? How will you know it is this? After post operation, what can you do? It is also important. Na?
okay. So how far it is connected with the medical science in that perspective, specifically when we talk about PCM and medical.
Yeah, someone asked Sunil, are you from defense? Yes, Sunil is from defense. He was from Air Force. I think one of your friend is from here.
यस सर, दिस इज डॉक्टर आनंद मौर्य. आई थिंक सुनील सर मुझसे मिल चुके हैं, हमने फेस टू फेस बैठा है. WAC याद है सर? सुनील सर, वेस्टर्न एयर कमांड SMC.
Sir,
आप मिल
until
चुके हैं.
until see your face, I think it is very long. see your face. I'm not able to recollect.
हम मिल चुके हैं,
It's very long.
चाय भी पी चुके हैं
It's
साथ.
round, huh? No one can.
Anyway, it's a good opportunity, good platform where we can have interaction and memorize our past.
See, that is why I say it is an interactive class. Let us interact ourselves and become friendly to each other. Let us not create a stressful environment in the class.
Right, sir, right.
Otherwise, the achievement is nothing. And I
Right, sir.
request all of you to write positive things in the group. Don't write negative things. It is too much. I don't know. If anyone is writing negativity, why do you become negative with him?
Yeah, definitely, sir.
Everyone is telling me negative, 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 negative in my life. Do I become negative? Hmm. So everyone should be what? First thing is everyone should be positive. What you can do, what you cannot do, you decide later on. First you learn. Learning is a lifelong process.
Yeah, sir. Definitely, sir.
This is what I have learned from you. You know, you came with your wife and son, and then you told about
Yes,
the
sir.
air marshal. And then the air
Yes,
marshal
sir.
was still alert that the Pakistanis are coming. You imagine at that age also, he was ready with this what you called alertness that Pakistanis can come. You have to be careful. That means what? You must be dedicated to your answers. Whatever you know,
Yes, sir.
whatever
Definitely,
you
we are
must,
now we are almost reaching the stage of senior citizens, sir. So we are
I'm also a
looking
senior
forward for
citizen now.
learning. So that is actually thing
What
which
do
has
you
driven
think?
us.
I'm also a senior citizen. No wife, no kids, nothing. I came in a part of senior citizen. People are calling me grandfather, uncle. So I'm a senior citizen now. Nothing to worry about that. All people should be happy. All people should join. All people should learn. And they should know their limitations. If they do not understand, we are there to make them understand what are the things.
So, learning is also the way.
For last 3 years, we have learned so many things.
That's right, sir. Learning is also a way of keeping our brain intact and keeping our neurons fine and healthy. And
This is what I say. Otherwise, we'll have dementia.
yes, yes, sir. Yes, sir.
We'll have dementia.
Definitely.
See, your small conversation with us made the stress of the classroom so light that now people can speak up. First of all, I wanted you to speak out. Otherwise, after the class, no one asks any question. I go out from the classroom. Where are your doubts? You ask here, you ask there, you get confused. So first you speak out. Learn to speak.
Yes, sir.
Good evening, sir.
May I know speaking?
Yeah, Rekha Shah.
Saji. કેમ છો?
બસ મજામાં.
મજામાં? સારું છે?
Yes, yes, first class, sir. Sir, my
So
son is
tell me.
my son is 21 years old. His speech and everything was delayed. His milestones were also delayed. And right now he's 22. The thing is, he speaks to himself a lot. And he's like the concentration level, like after a few seconds, he just goes somewhere else. His thinking process, I don't know where he goes. So can we?
Yeah, very right. See,
Yeah. So
now,
the process is,
now can I speak little on this?
yes, sir. You can speak. Sorry, sir.
See, as a acupuncturist, as a physician, Rekha, lot of things could be done in his youth. You did not have the sufficient knowledge. You did not do it. Today, the child will face all the situation lifelong. His career has been spoiled because of the lack of our knowledge.
Agree, sir.
Now, if you go to my Facebook and see, there is a child of a IGP, autistic.
Okay.
The IGP is so frustrated. He says that I want to kill everyone. It is the mistake of a Banjara Hills Apollo Hospital. Because of that, my child became autistic. His mother has committed suicide. This, that. You can hear every time. Anyone who has come to my seminar, will hear his lecture.
Okay.
But in his lecture, I understood the pain of a father, that after his death, who will see his son?
That is what, sir, always that goes in my mind. The same thing what you are telling. And I don't know, somehow I wanted some answer for this question, that what can we help? What
Okay,
can
suddenly
we do?
we have done NIBS and we have got a lot of control on this autism and this type of children. But then
Okay.
it takes time. Once,
Yeah.
see, the thing is the only thing which requires time. Otherwise,
Right.
heart, kidney, and all, either kidney will accept or reject.
True, sir. Because
But the
he
brain
had,
is the thing which slowly recovers.
yeah, sir. Like earlier, he used to be very hyper. He got MDR TB also 4 years back. So somehow I don't know what, and he in the night he is not able to sleep only.
Yeah, that is why it is G lymphatic system, which is what?
Mhm.
The removal of the waste from the brain with the help of
Ye-
CS fluid is not
Yes,
able to done. And a lot of neuroproteins have been deposited. As a result, a lot of things have been triggered.
true, sir. And sometimes he is absolutely normal, and sometimes he is very aggressive. I mean, you cannot predict what time
Because
what
you
he
are
will
not
do.
taking care of his food. Are you giving him gluten?
No, in the afternoon I'm not giving him the wheat roti.
No,
I'm giving
not
jwar
in the
bajri.
afternoon. In the day, do you in the daytime do you give him gluten, artificial sugar, sea salt?
No, no. Very less, sir. Very,
It
very
is
mild.
enough to trigger because anything when the micros biodata are deposited and negative bacteria are there,
Okay,
things will happen.
okay, sir. So, sir, but what other way we can help them out? Like, you
See,
cannot stop everything.
you can revive these people. They need a proper treatment. I call it NIBS, inserting a needle and brain mapping.
Okay. So basically, coming into this field is because of only and only because of my son, that I wanted some, because otherwise they give the medicine and they make them zombie. That is what I don't want to do.
No, it is not that much required. Where only medicines are there to control the seizures. But even then, the patient, you go and see how autistic was the child of the people know how autistic he was because he does not know the lady. The son of the IGP used to get the hand of the lady and used to go out. Now the same son is responding very well. He has
Okay, sir.
recovered more than 30% to 40%. And if you go to my Facebook, you will see his photo, video.
But the spectrum is so wide that like he is good in academic and everything. Only social and communication skills he's weak. So that part I'm trying my level best that he
How
can.
can you change the chemical and
Yes,
level of the brain?
there I'm not able to do anything, sir.
There you need. That is why you need knowledge also, help also, support also, treatment also.
Yes, sir. Yes, sir. Yes. That is the thing I wanted to come in this workshop. So I wanted to know basically.
Madam, there is a Zoom class. Workshop is
Okay.
only of 5 days.
Okay.
See, this is what you have to understand the definition of workshop, Zoom class, online classes. Everything
Hmm.
is definition, madam.
Yes, sir.
You understood?
Yes, sir.
The definition should be good.
True, sir.
Because if the definition of the disease is not correct, for example, I'm having neck pain, and it is just
Uh,
but because of a trigger point, and you are trying to operate the cervical spine. What kind of physician you are? I have
no,
seen
no.
that.
Right, sir.
I have seen the bills of 18 lakhs, 20 lakh, 25 lakh rupees, 50 lakh rupees in there.
I'm still not recovered.
Recovered, madam. I have got a patient of Gujarat like this in ICU. You imagine how
Mhm.
it was managed. like this, total contractures like
Okay,
this.
sir.
At least learn to understand. Learn
True, sir.
to go ahead. Learn to understand the subject.
But we need the teachers like you also, no? Because we don't find the person who can teach or explain where
See,
we
my
are.
benefit is that I don't have a family. I treat the patient and I come up. That's all. Sometimes my mood is off because of the hospital environment all the time, tension. And then suddenly a patient is singing, running and going because I stay in the hospital for 24 hours. I'm 24 hours, 24 into 7, I'm with the patients. So now
You have fully dedicated your life to the
I
patient.
have no other issues
Right, sir.
because I never married, no parents, no wife, no brother, nothing. So what to do? My
But
only
sir,
skip rate is what? This Zoom class. Why did I start Zoom class? To come out from the hospital and talk to you people.
but you have a good aim in your life, sir.
See, aim and ambitions are gone. At this stage
Okay.
of life, aim and ambitions and all these things are finished.
Okay.
This is not a regular class, I tell you. Please don't expect something regularly here. We are just going to be friendly to each other. And I'll continue these friendly classes because the problem with you is that after taking the class, no one asks anything and the class is gone. You go with your doubts, you treat the patient, you create complication, and then again you eat my head. So what to do now?
So one more question I want to ask. Like whenever he does the physical exercise, after that night, so he is not able to sleep only. I don't know why, what happens. I want that
See,
answer for that.
whenever you do physical exercise, lot of neurotransmitters like endorphins are released. All these are not balanced in the brain. Whatever you do. For example, a mother takes a child and he taps it like this, tap, 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 right?
Mm-hmm.
How does he recovers?
Yeah, but that stimulation on the spine.
No, madam.
Then
Endorphin is released. You know,
okay.
once a patient came with a severe pain in my clinic and he was not able to speak anything, what to do, what not to do. I just hugged him.
Okay.
His 50% of the pain was released. And it is written in the book.
Yeah, red.
Dopamine and dopamine was released. When you laugh,
Yeah.
what do you release? Dopamine.
Hmm.
When you are stressed, what do you release? Adrenaline.
Adrenaline.
Yes. So, what should be your answer?
So that means that continuously there, like before also you told, there is a crisis in adrenaline.
This
Adrenaline
crisis
crisis.
is not in only adrenaline. Many pathways are in the brain. It's a crisis. By subcutaneous needling over here, by mapping it properly, by understanding
Okay.
the functioning and putting needle properly, you can revive these people. I have been doing with
Okay.
autism child so much. Grade 4 autism I am treating. A person has come from England.
But sir, by
5%
only
hold him to put the needle. But in 4 days I saw he became cool down.
yeah, true, sir. But only like what happens, sir. We can learn like we can just learn from the Zoom, but practically it is very difficult when we are trying to do.
See, practically the first thing is that you started it right now. So why are you thinking of that?
Okay.
When you start in the railway station, do you think that I have reached Delhi?
No, sir.
Can I bring the Taj Mahal in your house?
No, I don't want. You can nod also.
No one wants it. It's a big headache. Even if someone gives me a Taj Mahal for gift, I'll say I don't want. Who will spend money on this heritage?
True, sir. Thank you, sir. Thank you.
My first request to all of you, please write positive things in the group and ignore negative things. Encourage others to study because I cannot take diploma course all the time. I want to do it. Become ambitious is not correct. You all have become ambitious. More questions, please. You have 13 more minutes to ask me questions. Please ask me. Why are you wasting your time? Ask your questions. You don't have any doubts. In WhatsApp, you have written so many things. Baap re baap. And when you come to talk to me, you have nothing. You are mum like a mew. When you shout in the WhatsApp, you roar like a lion. And when you come and talk to me, you mew like a cat. Now ask, what is the problem? Ask questions.
Good evening, sir. This is Shivani Walia. Sir, in this course, if we don't learn how to do practical things like what you have told us, it's in this diploma course, we only able to learn about the this treatment only, or we can perform the treatment after complete.
No, 1 minute. Until you complete, how will you decide what you have learned?
Yes, sir. But are we able to do the things after completion? It's just a query.
Ask Anand Moria. He came only for 5 days. After that, what he has been doing in his clinic? Anand, reply, I have answer.
It is a great experience to work the offline classes, that is the workshop, where the practically we can see perform the treatment on table, and when we really
First, he is
perform
asking about the online classes. What is the benefit of learning online classes?
online classes is definitely very good. It is just a clear whatever we have doubt in mind, just clear it, because we know many things, but we have more doubts and doubts. We are collecting just a doubt and doubts, and we do nothing because there is no other person which are going to clear the doubt. We just collecting the knowledge. We train many technique, but unfortunately there is a no correct way we treat the treatment because we have doubt. We know the Parkinson, we know the autism, but we are collecting the knowledge, but we are still gaining the doubts. It's better in our online class. We just ask directly in whatever local language or English language, just clear the doubt. Clearing doubt is the good way.
So interactive classes are for that. How much deep knowledge you have? What is your background, educational background?
Sir, me? Are you asking me?
Yes, yes.
Yes, sir, I'm a physiotherapist.
Acha, can you tell me what is the reason of Parkinson?
Sir, it is a disbalance of like chemical in the
I'm not asking you
brain,
what is
like
the
dopamine.
symptom of Parkinson. I'm asking you what is Parkinson.
Sir, it's a disease localized with tremors and stiffness and
I'm not asking you the symptoms of Parkinson. You're saying me the symptoms of Parkinson. I'm asking you what is Parkinson? Define Parkinson.
sir, it's a disease, neural disease.
What kind of neuro disease? Everyone knows neuro disease. I'm asking you define Parkinson.
Sir, it's a disease caused by a deficiency of dopamine in the brain.
Why dopamine deficiency is created? Yes.
Sir, I don't know the reason behind it.
Yes,
seen many-
that is a mistake. It is a neuroprotein called Sylvian protein.
Okay. Sir,
Yes,
some
so in Alzheimer, what is the defect? The defect of Alzheimer is amyloid beta protein, tau proteins.
yes, sir. Yes, sir.
How am I able to revive? Because I have learned a system from IP Cherian called G lymphatic system. That at night when you sleep, CSF goes and cleans it. Now I have been learning through acupuncture system how to revive the brain. When I went to Thailand, I saw there is a neurosurgeon, Dr. Diploma. He practices acupuncture with most critical cases, and he told me how using dermatome and myotome you can easily recover this type of patient. They don't need surgery.
Okay. Sir, you are having very vast knowledge about all the things. Your experience is too much high than us. Everyone in the group,
Madam, let us not create any inferiority and superiority complex here, please.
it's not like that, sir. We
No,
are here to learn from you.
I deny this. Let us not have that inferiority and superiority complex among us. That I am superior to you and you are inferior to me. No, we are all colleagues. We are
You
all
are,
we are
sir,
all
you are here
same
to teach
in
us.
the same platform. You are also a human being. I am also a human being, right? And the
Yes, sir.
topic should be over there. There is
Yes,
no
sir.
one senior. There is no one junior. If there is a patient who needs our help, we are ready to give them. Whom you cannot treat, we will help you to treat them. My only thing to you is that first thing is be positive and write positive things in that. Whatever you have learned today in the group, write that in a paragraph, point wise. In a small, it should be how much? 10 lines. But that 10 lines is the revision of what you have done. By making other positive, you also become more positive.
Yes, sir. Definitely. Thank you, sir.
So whatever negative was there, just abolish. You know, I'm the most negative person in my life. But my friends, I always say this hospital is uncertain and it will be closed. One of my friends is there, Mr. Ravi. He is the only positive person in my clinic who says this clinic will never be closed. And only on this positivity, I became positive to work in this clinic. Because I wanted to make it a charitable hospital. And to run a charitable hospital, we have to run the revenue expenses. Sometimes I feel afraid. Next month, if the patients do not come, we won't be able to pay our revenue. And he's the only positive person. Sir, everything will be all right. Next month, don't. Things will come. And I tell you, from last 2 years, I did not spend a single money in this clinic, and still the hospital is running. No advertisement cost, nothing. I came to Hyderabad with only 2,000 rupees, with no one knowing me. From there I started, and now I'm here with a 44-bedded center within a year. And people from all over India, they come here. You go and see my Facebook.
Sir, if we are very desperate to meet you personally, can we visit you there in your Hyderabad hospital?
I am also asking that question, doctor. At the end of the course, please invite all of us together to your
We
hospital.
always like create workshop every month. Anand, all they come for the workshop. Workshop is only my time pass of life.
Okay, thank you so much.
Okay,
So,
sir,
you'll
anyone from the group can visit the workshop?
Yes, yes. This is the workshop.
Okay, sir. Thank you.
thank you.
Every month there is a workshop. August, I thought patients will not be there, so I thought I will not conclude workshop. Now patients have automatically started coming. Because if there is no patient, what will I teach you? But this is the only clinic which runs without advertisement. Patients are bought patients.
Excuse me, sir.
Yes.
Bidun K Kerala. Ask him to remove his screen, so we can't see you on the bigger screen.
Huh?
Sir, Bidun K from Kerala. Ask him to remove his screen, sir.
No,
We
no,
can't
you
see.
can't remove your screen. You have to go up and then you have to.
No, we can't see you on the bigger screen, sir.
I don't know how to do it.
It's okay, madam. No issues. Yeah, thank you.
It must be from her settings, sir, because you
It
are
is from-
pinned on, so everybody is seeing you. So maybe she by mistake pinned somebody on.
It's okay. You learn from mistakes, you correct your mistakes, and you begin.
Yes, so she will know that she should just check it on her system to resolve the problem, sir.
Sir, doctor, in India now, for research research is in acupuncture, where are the places in India now happening? One center I know, it's maybe it's in under your center in Hyderabad, it may be happening. And I know
It is happening because neurosurgeons are there, MD medicine is there, orthopedic surgeons are there. So whenever they come in round, I never interfere. Cardiac anesthesiologist is there, well-maintained case diary is there, physiotherapist is there, right? Patients are alert.
No, see the problem now, see for Kerala, the state of Kerala and all now, this healthy not having a council for acupuncture is a big issue.
Yeah, forget
nowadays.
about the council and all. We are not here to discuss about the council. Telangana also has no council. We are not here to discuss about the council laws. First of all, we are here to learn the topic, subject, and to proceed. Physiotherapy has no council up to now. Why they are not working in around India? Did not they do miracles? Did not they do wonders?
Physiotherapist.
Yeah, physiotherapists have no council in India. Many states there is no council. They're struggling for the council. Aren't they working? Aren't they properly qualified? Aren't they working in multi-specialty, super specialty hospitals?
Yes. Okay.
Aren't they working in ICUs?
Okay.
Forget about them. I'm seeing in Telangana, RMPs are also doing very good.
Sorry, doctor, what in Telangana?
RMP, registered medical practitioner. That means a person who has practiced under a doctor. Now he has become a doctor.
Okay.
They are also doing very good. They are the one who's running now the super specialty hospitals.
Okay.
So see, let us not focus on anything else. Let us focus on our inner self, how to improve ourselves.
True, doctor. Yes. Very true. Thank you. Will do.
A question of comparison. The biggest thing in our life, what we make a mistake is comparing. If you compare, either you are inferior or you are superior. This comparison destroys the life.
Okay.
Right?
Excuse me, sir.
Yes, madam.
Sir, I'm Shilpa from Chennai.
Yes, Shilpa.
Sir, I just want to know about thyroid, sir. The thing is, the first time, like, I just had a patient who is not having thyroid gland right from the child, like from the time he was born. So, can we cure this issue, sir?
See, it's a juvenile issue. How can you create it when God has not given it?
Okay, sir. So he's the boy is supposed to take
Yeah, his
medicine
boy
for
is going
the.
to have some hormonal issues of his life, like body weight gain and other problems. He is going to suffer from that. Now we have to see how to overcome these situations.
That is what, sir. Is there any remedy in acupuncture, sir?
See, without understanding anything, I'll ask you, there is a patient who's having a stomachache on the left side. What is the remedy you will suggest?
No, sir. This is like something like gland which is creating an hormones and all, and
Madam,
it is
anything,
absent.
see, any problem, anything is a proper way. First of all, clinical history has to be taken. Then understanding of the disease has to be taken. Plan of the treatment with the discussion with the patient has to be taken. Then planning is made and explained to the patient, and then has to be proceeded.
Okay,
Doing
sir. No, sir.
whatever, doing whatever you like is just like treating gangrene by acupressure.
Okay, sir. No, sir. I just want to know, is there chances or not? So I'll
There
be
are
knowing
chances to
about.
overcome its limitations. Problems are coming up. There are chances that his problems can be solved to some extent.
Okay.
But what are the problems? Everything has to be noted down. And then everything we have to map, and then you have to create a way to lessen down his
Basically,
suffering.
actually, he's not having any kind of problem in physically, sir.
Then physically, if he's having no problem, if the patient is fit, forget. Leave the topic.
No, is there
Patient is
anything to
fine.
reverse the medicine, or because every 2 years the
No,
medicine
madam.
dose is getting reduced?
What is not given?
There's no chances, sir.
Madam, you are saying one side the patient is okay, and second side you are saying patient is clinically is dependent on medicines. Then how is he okay?
That is what, sir. I didn't get, like, I didn't understand what reply, like, whether we can
This
treat
is why
him or
I
is there
say,
any chances?
first of all, madam, first of all, we must understand how to do, what to do, in the manner we have to do. For example, if there is a large MCA in shock, there is no chance of recovery of paralysis. How patient recovers in paralysis? How putting one subcutaneous needling over here, patient revives? Why small stimulations by pain recovers autism? Why patients are finding better results? How could I revive the patient of Rita Shah who is having 5 sleep discs from L1 to S1 with just dry needles? My only humble request to all of you, if you have a small respect for me, in diploma training, please write positive things. Writing positive things only will make you positive. Sir, I want to improve my knowledge, so I want to study. I may use it in my practice, I may not use it in my practice, it is secondary issue. First, my knowledge should be of that level where I can be confident to speak on the topic. How many classifications of Parkinson's are there? How Parkinson is created, classification of Parkinson's, how syncope is increasing, what is grading in grade 1, grade 2, grade 3, grade 4, what is happening, in what type of Parkinson's, what kind of NIBS, what is this, all has to be studied. That is why I said, let 5-10 days go extra. Life has so much part of our life has been spoiled. So little more be spoiled in having some conversation. You are spoiling 23 hours a day doing gossiping, this. Let us do 1 hour gossiping of for a good purpose. Let us not make it a class. Let us gossip. Gossip means speak something which is helpful for you and us. Am I correct?
Yeah, sure. True. I agree, sir. Truly agree. Thank you.
Only one person agrees to my sentence.
Agreed,
Out of
sir. 100%.
So we all agree to you, sir. That's the reason we are you listening to you every day
Agreed,
so
sir.
sweetly.
Then why 300 people out of 300 only 124 has come? Why?
So be positive for that 124 now. Why looking at 300? We are with you always.
Because one thing is that you did not make your other, you are negative, so you did not make other positive. First, you have to be positive. How you will be positive? By encountering is what? Ignoring, I'm encountering. Sir, I'm here to improve my knowledge. Topic over. Sir, I want to learn this. Topic over. People always think about end result. End result is death, for which you and me both are waiting. Right? So before death, what we can do? We should learn, and how we can implement it is our view. What is legal obligation that we must see? What we can write in our vouchers that we have to see? Rules, regulations are one side, the knowledge is the other side, and how you can help your family is one side. Let me see tomorrow how many of you all be are positive. How many more people can come? How many more people you can make join this group? Let me see how much you can do. Small contribution to the society. Don't tell me I called up this friend, that friend. Let us see how much positivity is there in yourself. I've heard one sentence before closing. When I was very small, there was a school of thinking, there was a class going on online. So the glass of water falls down while you're eating food. You scold the child, can't you see and walk? It's your mistake you have kept the glass there, not the child's mistake. But you blame others. We have the habit of blaming others. First, stop blaming others. Second, believe in divinity, it will show you the way. I always remember one story. Mind watch. It was a song which I used to see and always used to think, can I help this autism child, CP child? Can I allow them to die like this? I said, no, CP child will start recovering. It was like my dream. I was only known for sleep disc and all, but suddenly I became a CP expert. I studied so many books. How to do brain mapping of CP child, I never knew. I studied and I became. With only one person came to me, ADHD. And today, I saw the son of IGP who was so aggressive has become 40% okay. You go and see my Facebook. Why don't you do research on my Facebook videos? Why don't you share those videos to others? Why don't you ask others to learn? Why does knowledge does not spread? Because of our own selfishness. And that is the biggest negativity we have. For example, in this class, everyone's camera is off except mine. No one wants to open the camera so that we can have facial interaction. Everyone's camera is off. I don't know why.
So my camera, I don't know, some technical issue. That is why. Thank you.
Maybe with you, but what about others?
So give an instruction, sir, to open all the cameras coming for
I'm
the
not
next.
here to give. I'm not a judge. I'm not a judge to give an order that please hear me very carefully. Please do this practice. I'm not a judge of a court. I'm just your guide. Take me as your mentor or a guide, not even your teacher. You want to hear this old man, you hear it. If you don't want to hear it, just close your ears and forget it. Whatever I spoke, just forget it. But remember, if you want to practice, practice in a nice way. I never put any certificates in my wall. You see, this is my room. Many certificate is there in my wall. I am myself a certificate. Before leaving this class, my only humble request, do not go with negative gossips, go with positive things. Ask as many people as they can join. The fees is very less. Improve your knowledge. What you can learn, it depends on how much you want to learn. The rain is coming. How much you can take in the bucket is up to you. You want to be a river, you want to be a pond, you want to be a sea, you want to go deep. You know, Dr. I.P. Cherry, one of the renowned neurosurgeon, Lakshminath, told me one word. What you know? Cooling and cleaning of the brain. From there, I took out so many things. Today, Parkinson and all many diseases have become very easy for me. Recovering paralysis becomes very easy. I never understood putting one needle and recovering the quadriceps muscles over here. I've changed the entire system of scalp acupuncture, what you call it. Needle is same, only the procedure I made it little different. And so easy, no points, nothing. Doing, and you check the strength. Immediate improvement. I'm recovering a voice of a 10-year-old person who has fallen down has come from Delhi with only one word, my pain, stimulation. And I'm every day trying to improve more and more of his speech. The mother said in 10 days, if you show me 6% result also, today we have more than 10% results. His clarity is more. After tomorrow, I'm going to bring him on stick. No one took that effort. He's still using stretcher for the last 8 years. Walking stretcher. Is a condition of the mother. How much you can bring in this life? Only by changing your own attitude. First, our attitude has to be changed. Our approach has to be changed. If not, today that person came, can you recover my son who's quadriplegic, living on ventilation? The doctor said you can go outside and inquire. Someone told me, sir, you can do it. I told, see, this is the child which I am recovering. We talk to the mother. This much only is my counseling. They said the immediately is removed from ventilation, stable, will bring the patient to you. I said, yes, please. All those who are delayed milestones and all, we will try to revive them. Without side effects, we will do it. All is up to you. What you want, what you don't want is up to you. What you want to accept, accept. What you disrespect, disrespect. That's all. But from tomorrow, please don't write nonsense in the diploma training. Write something good. I'm tired of answering your useless things. They are making the whole environment negative and fearful. In fear, no one can learn. First, create a fearless environment, what I am creating right now, talking to you. Then, knowledge will come. Knowledge will only come when there is no inferiority and superiority complex. When we are colleagues and we talk together and sit and discuss. That's all. There is no teacher, no superior, no inferior, no senior, no junior. Finish. All barricades are over. You must free to talk. Wherever the limits are crossed, we'll have some barricades. That's all. Topical. Any more questions for the day? Any more questions? For all the classes are recorded and you will get it in the diploma training class.
Thank you, sir, for the clearing the doubts.
Thank you, sir.
No doubts, only 3 questions. What doubts you have? You don't even have doubts.
Sir,
What
I was
thank you?
having
I
you
disregard
clearing
your
the doubts.
question also because you don't have doubts also. Your knowledge is also, I don't know what it is. The one who has no doubt has no knowledge. It is just like me coming and speaking on the walls and going. One person is too early for today and too late for tomorrow.
Sir, I got a ray of hope at least.
You
Thank
get
you, sir.
give tomorrow in the WhatsApp diploma training club group. Write something. Let me see how much ray of hope you can give.
Sure, sir.
Let me see. Else I will also give you ray of darkness. You want a ray of hope for you and ray of darkness for others. What is that? Certificate cannot do things. Your knowledge only can what? Aspire. How to confidently I speak to the neurosurgeons? How confidently I go to OTs? How confidently I understand, oh, this is to be done like this pathway we have to obtain. How confidently I create pathways in the brain. Only by talking to you people. You send me the most critical cases of your clinic, and recovering that clinic is only my exam. You are the best examiners of my life. You send those patients who cannot be recovered by you, nor by the neurologist, and you send it to me, and then I have to sit whole night to recover them, and that is the best examination I have. Who is my examiner? You people. Hey, bubbly, be quiet.
So tomorrow session regarding same interaction tomorrow also.
Yeah, we will continue interaction because people are still fearful. Still,
Yes.
so much fear is created in the what you call diploma training class that people don't want to join the class also for interaction.
Yes. Please interact, all of you. Please interact with the doctor. Clear all your doubts, please. Open your video tomorrow. Thank you.
And go and speak something positive. Otherwise, you are negative and everything is negative. So can I practice? You don't know anything and you do anything, you will go to jail. It is same with the allopathy doctor also. He's a plastic surgeon and doing keratotomy, will go to jail. What rules applies to you applies to everyone. You understood? Whatever rules, जो rules आपको apply करता है वो सबको apply करता है. Understand?
Yes, sir.
Yes, sir.
Yes,
Yes.
sir. It applies to me. That is why I work with a critical care doctor. I work with physiotherapist. I work with medicine doctor. I work with orthopedic doctor. I work with neurosurgeon. Why I do this? Every time I get something to learn. Right? Thank you so much.
Thank you, sir.
Thank you for the day, sir. Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Recording देखिएगा, प्रकाश जी, recording देखिएगा. Sayonara, 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 sayonara. Sayonara. Sayonara means bye bye. In Japanese, it is called bye bye. Thank you so much.
Good night, Sastri.
Kublai Sir.
Bye, sir. Good night.
Kublai Sir. Thank you so much. Bye. Bye.